Pennsylvania County Fire and Rescue Commission meeting Thursday, October 17th, 2024, 6:30 p.m., 39 Bank Street, Chatham, Virginia. Call the roll, please.
Jimmy Atkins,
Present.
Ben Meeks,
Here.
Alan Casper, Ward Rowland,
Here.
Tim Cassell,
Here.
Brian Shields, Jason Lovelace, Kermit King,
Here.
Steve Stallings, Coleman Mayhew,
Here.
Bert Sellers.
All right, thank you. And just so everybody knows, we have to have 7, and we've got that, so we're good for a quorum. So we're going to do a moment of silence, and then we'll stand for the pledge. Thank y'all. Please stand for the pledge. Pledge allegiance to the flag of the United States of America, to the republic which stands one nation under God, indivisible, with liberty and justice for all. All right, thank y'all. All right, if y'all would take a moment and review your agendas, please. And if there's anything to add to the agenda, we can make those revisions now. All right. Is there any revisions to the agenda? If not, I'll entertain a motion to approve the agenda.
Motion to approve, Mr. Chairman.
Okay. Got a motion. Do we hear a second?
Second.
All right. Got a motion and a second. Coleman Mayhew was a second. Any discussion on the motion? Hear none. Call a roll, please.
Jimmy Atkins,
Yes.
Ben Meeks,
Yes.
Alan Casper, Ward Rowland,
Yes.
Tim Cassell,
Yes.
Brian Shields, Jason Lovelace, Kermit King,
Yes.
Steve Stallings, Coleman Mayhew,
Yes.
Bert Sellers.
All right. Thank y'all. That motion is approved. Now review your minutes, please, from September, and then we can entertain a motion to accept those. All right. Entertain a motion to approve the minutes.
Make a motion to approve the minutes.
Okay. Got a motion. Do I hear a second?
Second.
Okay. Motion by Coleman Mayhew, second by Vice Chair Kermit King. Any discussion on the motion? Hear none. Call a roll, please.
Jimmy Atkins,
Yes.
Ben Meeks,
Yes.
Alan Casper, Ward Rowland,
Yes.
Tim Cassell,
Yes.
Brian Shields, Jason Lovelace,
Yes.
Kermit King,
Yes.
Steve Stallings, Coleman Mayhew,
Yes. All right. Thank you. That moves us down to presentations. Danville Life Saving Crew Community Paramedicine Program. So come on up, sir. And welcome.
Thank you. For y'all that don't know me, I'm Keith Carroll. I'm a 37-year member with the Danville Life Saving Crew. I'm a paramedic. I'm also their battalion chief of community paramedicine. And I'm going to review community paramedicine with y'all just a little bit. So, on a typical 911 call, we get punched out for the 911 call. We're going to use Aunt Sally today. She's having trouble breathing. We go by the house, see her, do an assessment on her. We give her a breathing treatment, try to stabilize her in her house. Let's say she's got COPD or asthma. We try to get her and encourage her to go to the hospital. We transport her to the ER. She gets advanced care. Hey, they get Aunt Sally stabilized. They give Aunt Sally her notes and say, hey, you need to go see your primary care physician in 1 to 3 days if you can. Set your appointment up. Aunt Sally's happy because she feels better. Aunt Sally goes home. That's Aunt Sally with the smile on her face right there. You see the smiley face. Go to the next one. So Aunt Sally starts calling again. Hey, the hospital didn't fix me. I want to go back to the hospital. Heard that 100 times, and if y'all run EMS, y'all have heard it the same way. Aunt Sally goes back to the hospital, and we start a repeat. We go through the same thing. We give her a breathing treatment. She gets to feeling better, and she starts going back and back and back. What you don't know is Aunt Sally's smoking cigarettes at night, and it's messing her up, and she ain't gonna, that's what's causing her problem. So 2015, we started seeing a lot of repeat patients. We had patients calling daily to go to the emergency room. Some of these patients would even use us as just transportation to get us from the ER so they could walk down to the friend's house right there, daily. 2015, the crew got agitated with it. They brought it to their board of directors. They said, hey, we got to do something about this. What can we do? So the crew did a study. They hired Johnny Mills, and Johnny goes out and sees what other organizations are doing throughout the country. He saw community paramedicine picking up throughout. And the biggest problem the state of Virginia has at the time, they did not recognize community paramedicine, but they did recognize community health worker. So he based our program on community health worker. He brought it back and says, here, this is what I think we ought to do. Let's start this program. We call it community paramedicine. It's based on community health workers going out here and working with the patients and put a program together. They got him to lead the program. He went to Pittsburgh, got his community paramedicine, come back, got his community health worker license, and started the program he put together. 2019, they hired me. I had been a paramedic for, like I said, 30-some years. I also did outside sales, so they knew I was a talker, and I could shoot it pretty good right there, and they hired me to work the program starting the first part of that year. So now, when Aunt Sally calls 911, and she goes through the process, and she goes to the hospital, and she gets happy, we try to get in there as community paramedicine and break that cycle of what she's doing. Okay? Go ahead and throw the next one up. So that's what we do. We come in and assess that patient and go through it. So this is our mission. Like I said, in 2017, it's the divine mission to provide supportive health care and preventive services to the underserved populations of the city of Danville and the region right there, and try to make our patients more self-sufficient in taking care of themselves. This is some of the statistics of some of the patients that we worked with in 2021. It's based on age. You'll see the number of 911 calls based on that criteria for that day. You'll see from the age group who's calling the most. And it looks like it's between 70 and 90. They broke it down, male and female, how they're called, what the percentage was, and then the race right there. So we go in there and try to figure out who our patients are. Most of them are chronic, have chronic health issues right there, which are like diabetes, COPD. Addiction's a very big one this day and age. In this area, you're going to see diabetes and hypertension, heart disease. They may be like myself. They may be a little bit big, got obesity in there. Asthma, mental health conditions, that's a big one in this area. and pregnancy. But we also look at what their social determinants are, and I'll talk about that in just a second. What factors do they have that, or resources are they using or don't have in their social determinants? So just like any 911 call, we're going to go in there and meet this patient. Hopefully they're receptive. They've got to be receptive. I can't force anybody to do anything. The only time I can force a patient to do anything is if somebody is their legal guardian right there, okay? We go in there and do the assessment on them. We do the assessment. We see what they need to be stabilized. We go in there and we try to educate that patient. We navigate that patient to what resource they need, be it a doctor's office, be it insurance, be it to wherever they need. We try to be their advocate, and we also support them, okay? So we look at their community. We look at their chronic health. We try to see what it takes to stabilize that health, but now we're into the social determinants. And we look at what resources they may have, okay? Do they go to a church? Do they have friends that can come over and help them? Do they have supportive groups that can help them? Are they a part of any social clubs? We look at their transportation. Do they call 911 because they don't have transportation and they're using you for transportation? Hey, do they have reliable transportation? The car's broke down. I can't find nobody to fix it. I don't have the money to fix it right there. So I'm going to call 911 and get me to the hospital instead of going to their doctor. Okay. And what physical, mental, or geographical barriers are they using? Do they have so they can use transportation? Do they know how to use the bus? You know, the city has a bus service, which is really good. The county also has a transportation service too. A lot of folks just don't know that. Go into the next one. Then we look at that patient to see if they've got funding. Do they have money? Do they get SSI? Do they get Social Security? Can they pay their rent? Rent's done doubled right now. Now they got to start thinking about how I'm going to pay the rent and pay the utility bill, or how I'm going to pay the rent and buy food right there. We look at all these little factors. When I knock on the door, I want to make sure they got the lights on. Do they have electricity? Is it warm or cold in the house they're living in? Is it appropriate to where they can live? Do they have food in the house? I saw a guy the other day, he's a bad diabetic, didn't have a bit of food in the house. Had to go out and find him some food and brought him some, just so we could stabilize him. Do they have adequate health insurance? Some people don't realize, you know, they may qualify for health insurance right there. They may not want to pay for that health insurance. They may be some ways they can get insurance. They may be a veteran, not realizing what benefits they have right there as a vet. May not ever use them, don't want to use benefits, feel like they're a burden to society right there. Do they have the competency to manage their finances? Some people just call the bank, see how much money I got, and they write a check and go with it right there. They don't see how they're spending their money. Do they know how to use a debit card? I know that sounds stupid, but a lot of people this day and age still try to write a check. They try to have cash on hand and try to pay cash. Next, please. Then we look at their environment. Where are they located? And if they're out in the middle of nowhere, where do they get their food from? Can they go to town and get their food? Can they go to the grocery store? Are they getting their food from a convenience store right up the street? Are they eating junk food all the time? Is that causing some of their problems right there? I mean, it's just really, do they have housing? Do they have a house to live in? Are they living in the shack out back? Y'all looking at me like, hey, but they really do. There's some people out here that still live way below the means that you can ever imagine right there. Again, do they have utilities in the house? Is the lights on? Or they have heat? Are they running a drop cord from the neighbor's house? Are they using water from the neighbor's house? Sanitation. And we do go in there and look and see if they got a working CO2 monitor and the smoke detectors work in the house so they don't burn themselves up. Or a lot of these people live alone. We want to know, do they have anybody they can count on? If they're living alone, do they need an aide? What assistance do they need for their daily living? Do they have a primary caregiver? Do they have a post as a form that a healthcare, the regular, to say, hey, when I pass away or as I'm dying, this is how I want my things worked right there. Go to the next one. In the health end of it, we want to know that medical history, and we want to know that assessment. We want to go back in there and reassess them frequently to make sure they're stabilized. Their blood sugar may be good today, it may be through the roof tomorrow, and it may be down to nothing the next day. Are they seeing a doctor? Do they have a doctor? How many EMS calls have we had out here to this place? How many times did they go? A lot of people call 911, won't go to the emergency room right there. Are they having to be hospitalized if they're bad enough? What medications are they taking? And again, how they're eating. Let's look at your diet. Let's look at making sure you're getting up off the couch and you're walking around a little bit and you're doing something. Do they have addictions? Are they smoking? Are they drinking too much? Is that causing a problem? So we look at all those different factors right there to build our assessment and try to put a plan together to stabilize that patient. And hopefully we can convince that patient to navigate him off of what's causing his problem and better take better care of himself. So how do we get our patients? So Danville uses their statistics a lot of times off of ESO. They'll see where we can see our patients to say, hey, Aunt Sally called 3 times, and we know we need to start going by Aunt Sally's house. And again, that ESO, every one of y'all use it in here, but if they spell the name wrong, you won't catch it. That computer is a computer when you're adding into it right there. So you've got to be very detailed what the information is you're putting into your reports. Or you may not catch the problem until it's way bigger than you think it is. We get referrals, again, through our ESO. We've got mobile integrated health we can click on in Danville. I don't know how the county if the county can use the mobile integrated health and how they can make it work to benefit y'all to see if one agency hits mobile integrated health, will it just give it to their agency? Is that the way it works? And they should use that. And that way it will build hey, I got 5 places we need to send community paramedicine to go see. The fire department in Danville will call us or send us information and say, hey, go see this patient. We're doing a lift assist 10 times a day right there. The police department will do it and say, hey, we got a homeless person over here that we're having to go see daily right there or nightly right there and having to encourage them to go to the hospital. Pennsylvania County, public service. They give us references from the departments that send them to them. Social services will call me and, hey, can you go do a well-being check? Or we've got somebody we think might benefit from your program. APS, case management from the hospital will say, hey, they'll send us a patient every once in a while. Can you fix them around? It could be as simple as that. Other community health workers in the REACH project in Danville and the public will sometimes raise their hand and say, hey, can you help us? So these areas right here are where we're actually getting our patients from. We normally see approximately, we visit with, on an average, of 100 patients, individual patients. I'm not talking about repeat patients, but unique patients, I guess it is. We do 100 unique patients on average per month. We usually, on that, we do 300 to 400 connections for those patients that we're seeing. And that'd be connecting them to a doctor, could be connecting them to food, could be connecting them to insurance, could be connecting them to social services, to housing, whatever. Go to the next one, please. All right, just for the county, and me and Chris, I sat down with Chris a couple weeks ago, and we sat down and I took the numbers that he had. 2022, we had 18 referrals from the other agencies, of the county agencies. 2023, we had 16 referrals. As of this year, I think we've had 11 referrals. And right now, actively, I think we're seeing 4 patients in the county, if I'm not mistaken. Go to the next one. Anytime anybody feels like their patient needs community paramedicine, I want y'all to email that request to public safety, Chris Key and Casey. I get agencies, and I'm not being negative about it, they'll call me and they'll say, hey, Keith, I want you to go by and check on this patient. We got a patient over here that's got a problem. I want y'all to send that, any information or anything that you've got patient-wise to Chris and Casey so they can document it, they can track it, they'll send it to us, we will go out and see it, and then I can go back and I can call Chris or Casey and say, okay, we're seeing Aunt Sally right now, we're working with Aunt Sally. Or we've got 11 patients from you, and these were compliant, these were non-compliant, and these are not at home, they won't answer the door when come knock on the door. So that way we have a chain of command that we follow, and that way when hypothetically Laurel Grove comes up to Chris or Casey and says, hey, I told Keith Carroll about a patient. He ain't going to see him yet, I don't think. We're still going out there 25 times. If you go through Chris and Casey, we follow a chain of command. That way they can be up, they'll know what's going on, they won't be blindsided, and we'll all be in the same loop together right there. You agree?
A question, they've got to accept your help, am I right?
Oh, yeah.
I know we've referred more than that, but everybody hasn't been receptive to needing help or accepting it, so to speak.
Those numbers was off that list you give me, and I did the count right off of them, and you're right. We knock on the door, they're not at home. We go to their house 5, 10, 15 times. They won't answer the door. They peek through the shades. They're not going to come to the door. I see that all the time. They may be working. They work during the day and they come home at night. We had one up in Gretna like that. Never could catch up with him like that.
But they can also refuse your help.
And
even
they
if
can
you
say,
talk to
say,
them.
no, I don't need them. I don't want you. I don't think I need anything like that. I don't know why you come by here to see me right there. So they've got to be very receptive to what we're trying to offer them right there. And then again, if you said, hey, Keith, we're still going to this address right here, and I'm going to throw up the next slide and I'll explain what I'm going to get to. We want to know why that patient's calling 911. Okay, Aunt Sally falls 3 times a week. We're always over her. We're getting her up out of the floor. She doesn't want to go to the hospital, but we get her up out of the floor. You know, we've got her up out of the floor 15 times. And when we knock on her door, if we don't know that part of the information, we go in and say, hey, you know, we're community paramedicine. We were asked to come by and check on you and see what you need. Do you use 911? No, I don't call 911. But if I know that reason, and I'm going to get to it right here, if you've called 911 15 times and you send Chris and Casey an email and say, hey, Aunt Sally keeps calling, she keeps falling on the floor. We've been over 15 times. Now you're aware of it. You're going to make me aware of it. And I know what to go in there and talk to her about when I catch Aunt Sally at the door right there. And she still may not be receptive, but we're still going to come in there and keep chiseling away at her right there. When you give Chris or Casey the information for a referral, make sure you got their name. Make sure you say, hey, it's Aunt Sally or Uncle David. It's Uncle David Jr. It's Uncle David III. You give us an address, make sure you give us an apartment number or a lot number if it's in a trailer park also right there. Because we can pull in that trailer park right around all day long and might not know where that patient is inside that place. The birthday. The reason I want to know the birthday again is if I'm dealing with David Sr., David Jr., or David III, it'll kind of separate who I'm trying to work with. And then the big reason is why they're needed. That kind of gives us an idea of how to put a plan together. When we meet Aunt Sally, we know she's smoking cigarettes. It stinks so bad in the house. She's got to be smoking more and more and more. And she's got COPD problems really bad. So we really need to know why you think we're needed. Are they calling multiple times? If so, how many times? Hey, Aunt Sally, you've called 15 times this month. And it seems like you're having some breathing issues. We would really like to work with you on that. She may throw up her hands and say, yeah, I really do. I need medication. I don't have medicine. I can't go get my medicine. Then we start putting a plan together. And I know it sounds kind of weird, but we try to build their trust. We've got to build that trust with them to say, hey, they're trying to help me. Instead of, hey, they're trying to put me in a nursing home. And we're not trying to get anybody out of their home. We're trying to help them really. So that's why we need to know their complaints. And that's why we need to know what that provider is seeing going on inside the house right there. Hey, we had a patient that she was requiring, or the patient, let me rephrase that. The patient was requiring us to help that person out of the house. She had broke her leg. She was calling 911 frequently. She was using a department for a lift assist. Hey, I need y'all to help me. I need you to help me get out to the car. She doesn't run a stand. That fire truck's $1 million truck sitting out there, and it's got 2 people in it. If y'all paying people, there's a cost right there. Well, that ambulance showed up, it's got 2 people on it. That's a half or a $250,000 truck, $300,000 truck. Each time you call 911, just for the lift assist, we don't mind coming in there to help you that one time or that 2 times, but if you're going to start using us repetitively, there's a lot of cost. It hurts. The county's paying for a lot right there. The agency's paying for a lot. So we want to go in there and help them, but we want to educate them to say, hey, this is what 911's for. Can't you get your brother that lives next door to you and him and his son to come over and help you lift, get you into the car or get you back out of the car? We look at all these factors to try to say, hey, what can we do to help that person right there? It could be as simple as the house is cluttered and she keeps stumbling over stuff. She may need an aid. She ain't able to go in there and pick up stuff in her house, clean up. It could be the pets around her feet. I've seen that before. I'm not kicking dogs or cats or anything, but people trip up over them if they're elderly right there. It could be the bottle of alcohol she's got on the counter right there. And they may not want to stop the problem that is causing it, but we can go in there and encourage them, at least we can try. And someone may say, hey, I do want to quit smoking. Hey, I am homeless. I want to get into a shelter. It's cold outside. I'm calling you daily now because of that. So that's some of the information that we need, and Chris needs that. He needs all that in an email, and he's going to pop the button and send it to myself or Johnny Mills, and it's going to come right to us, and I give it to the nice ladies that work for me right there. I got 3 awesome community paramedics that work for me right there. 2 are my EMTs. One's an EMT, one's advanced, and one's a paramedic. And each one of them are excellent at the care that they give and the compassion that they give these people right there. Go to the next slide, please. Go to the next one. A lot of times, Chris or Casey may not see this. They may see it on a 911 end if they see that call going to the same address, but they may not see it unless y'all flag it and say, hey, I got a problem. Mr. Cassell right there told me he had a problem out in the county right there. That was a certain address right there, and I know the address, and I don't know if there's anything we can do, but it's something to think about. Somebody needs to say something to the owner of that address and say. But a lot of times they won't see it unless their dispatch will tell them the address. So if they're going to 123 Hunter Street and they're going for Aunt Sally because she's got COPD problems, they may see the address, but they may not know the patient right there. So that's why it's so critical to give them all that information. And then it kind of, everybody knows where we're at. They may have talked about this the last time we were here, but we'll do it again. I had one patient. He had a bad leg. He utilized 911 daily for lift assist. He wore Depends as a diaper. He'd get intoxicated. He'd slide out of his chair. Whatever he had in those Depends would blow right up his back, just like a baby right there. He would expect people to come in there and clean him up. He expected the 911 system to do it. He did it daily. And he was brought before a judge. It got so bad with his problems that he was brought before a judge twice, and the judge just threw it out of court. He wouldn't do anything with the guy right there. So every day we had a guy on a wheelchair, intoxicated, going up and down the road, falling out of his chair, falling daily in his apartment. He utilized 911. Every time their fire truck went out the door right there, that's a $750,000 to $1 million truck right there. It's got 3 people on the truck. The money adds up right there. The fuel adds up. The maintenance adds up. And it does the same way into the county. So he's calling daily. He's got an alcohol addiction. He's got other addictions right there. He called 911 over 100 times for a lift assist, and that was just the fire department, and he called the crew 55 times. So 155 times in 9 months, this guy called 911. All that adds up. So the quicker we can get in there, figure out what's going on, and hopefully can get him compliant, the quicker we can stabilize him, and hopefully, and I don't want to say I don't want him to call 911 no more, but we try to see every reduction as a success. If he's called 155 times in 9 months, and we cut that in half the next year, and we cut that half to a half the next year, and we cut it down almost to nothing, that's a great success, especially for the city or the county right there. So that's one thing y'all have got to think about that. May not can go in there and fix Aunt Sally right off the bat. She's going to have COPD for the rest of her life. But if we can cut her off of cigarettes, get her managed on her medication, we may can cut her call volume in half or 2/3 or 3/4, and she's only calling now once a month where she was calling 10 times a month. So we worked this guy for 9 months. I did. And you got to figure out where you're going to start. I mean, I'm trying to build this guy's trust. He's fighting an addiction. COVID's going on. He didn't really want no help. Go ahead and give me another slide up there. I sent this man everywhere. In fact, he had such a bad leg that he wanted it amputated at one time. And I thought I was going to be able to get him amputated, that one leg. In the wound center, one said, yes, it needs to be amputated. One says no. And I finally got him in Korean. Korean trimmed on his toes and said, hey, we got him stabilized. Now we're going to put him in a nursing home. And I thought my problem was solved. And a competent person can sign themselves out of a nursing home anytime they want to. I don't care if they're bedridden at home. They raise their hands and say, send me home. Pretty much, by law, they have to be done. So I made 63 visits in 9 months to this guy. I made 195 phone calls. I'm calling anybody and everybody that would listen to me right there to see how I was going to get this guy stabilized and literally get him into a nursing home because he needed one right there. And the biggest factor that got him in a nursing home, it was September to October. It was getting cold outside. And he raised his hand and said, hey, put me in a nursing home because he didn't want to get, he didn't have no aid, and he spent most of his time outside. And he raised his hand and went back into a nursing home. The way he got started was he was in a nursing home and got kicked out of one. So he's now in Martinsville, so that's a good thing. You can go to the next one. Some of the future, you know, I can see community paramedicine growing. As the 911 calls increase, I can see this thing increasing too. Because the more people we're out there trying to help, the less call volume, hopefully, it will make your departments have right there. And it's just really growing. And that's it.
Nice.
I've got a question up here.
I'm deaf, man. I'm sorry. I'm
There.
deaf on the left side.
Me
I can't
too.
hear what we're saying on the front.
Are y'all available to talk to patients in assisted living and talk to the management of assisted living
You know,
facilities?
we've actually went in there and seen a patient at the assisted living place you're talking about right there because they were utilizing 911 so much. I'd worked with this guy in a group home a few times. I lost him a few times. Social services was looking for him a few times, and we caught him back there.
Well, sometimes the management needs to be educated on what is actual 911 call or whatever, you know.
Yes,
If they
sir.
call you, tell them that the doctor said they need to transport to the hospital because the lab work came back from 2 days ago, so they have low sodium.
And that's that's messed up. The bad part about transportation is, and I don't know if this guy's if he's competent enough to get on a bus. Is he able to get on a bus?
So it's not just one person at this
Is
facility.
he a wheelchair patient? And sometimes they can call the Medicaid. If you look on the back of the card, they got a transportation phone number. They can call it and say, hey, Dr. So-and-so is requesting them to be transported on up there. If that transportation company would call the doctor's office and the doctor's office says, yeah, we want to see him on up here pretty quick, can we get him up here in the next day or two? They'll do it. Most of the time it takes 5 days to line up a convalescent trip.
Right,
the
that's one with the
insurance
low
company.
sodium. The doctor told him he needed to go to the hospital that day.
And I get that, and sometimes I've seen nursing homes that if you'll listen to some of the nursing homes in Danville, they start punching out. I'll listen to the room numbers, and the room numbers are very consistent right there. And it's almost like the same person's punching all the 911 calls out for their patients right there. I'm not saying anything negative
Right.
about it, but it's kind
Right,
of
I was
odd.
just curious if y'all could talk to
And I'm not
management,
saying
kind of
we-
explain to them or what, you know.
I'm not saying we can't. We'd be glad to if that's what we need to. And
Well, I'll get with Chris.
that would be the best thing to do. Say, hey, you know, and we'll just go up there and talk, and sit down with them, and hopefully they're compliant. But some of these people that know how to, some of these nurses that know how to work the system, will work the system, and they don't realize what they're doing to you or to anybody else right there. The smart thing to do is that number, you know, I can understand if they're a dialysis patient. Maybe they need to go on. Maybe they do need to be in that emergency room right now because they can't get their levels out of whack. It'll fix them. But I can see, you know, this level, the doctor saw 3 weeks ago, and now he needs to go to the hospital, and we picked it up, and we need to send him on up there. And that burden's
They got
got,
out this morning, they gotta go back tonight.
yeah. Ain't that something? But it could be a lot of times the nurses or the staff, I'll just say the staff, if you listen to the numbers, or you'll hear consistent room numbers going out. I mean, we'll go to one nursing home, we may make 5 or 6 or 7 calls a day to that one 911 to that nursing home right there, and those room numbers are very frequent.
I'll agree with Chris.
But ask them, and we'll be more than happy to go by there and just sit down and talk with them.
Thank you, sir. Anybody have any other questions? You answered one of mine. I seen you had 3 people working for you. That's great, and I hope the program continues to grow. How are you guys funded? As far
How are
as,
we funded?
yes, sir. How is this program funded?
The 3 ladies are funded through the REACH program. So the REACH program here in Danville has about 22 to 24 community health workers. Right now, they're funded through 2025, if I'm not mistaken.
It's definitely something we want to keep
But we'll
going.
take any offers that y'all want to offer and say, hey, be glad to.
Well, I just thought it'd be good for everybody to hear food for thought, how you're funded, so.
I'm paid directly through the Life Saving Crew. The 3 ladies are paid right now. They're funded through the REACH program. And REACH has they got Gateway Health, they got PATH community health workers, Gateway Health has community health workers, DPCS has 2 or 3 community health workers, the health department has a couple health workers, and they fund those workers right there, CHWs.
Well, I think you got a great program, and I hope it continues to grow. I know I've personally referred some folks to Casey and Chris, and sometimes that's, people don't have family or means, they just need a little help, so we appreciate what y'all doing.
But again, y'all got to understand, I worked with a woman today, or a person today, I gotta watch what I say. Since 2021, and we think we've got this person stabilized today, and they may show back up tomorrow. They were a homeless person, they're on the street, it's cold, they're calling daily now. And again, if we cut those calls in half, that's a success. If we can cut it even more, that's an even better success. And that's the goal right there, is to keep cutting those calls back. Again, these chronic health patients, they may not be able to fix the problem, but you can help them better manage their problem, and maybe it cuts their call volume in a whole bunch.
Absolutely. Any other questions? Thank you so much. We appreciate it.
Thank y'all.
All right, that brings us down to hearing of the citizens. We got to hear of the citizens signed up.
No one signed up, sir.
All right, thank you, sir. Skip my little spiel there. Brings us to Fire and Rescue Association reports. Chief Maracas.
Yes, sir. Last night we discussed in regards to the ESO reporting system. For those that aren't aware, the ESO reporting system is a reporting system that was based through to log your EMS calls throughout the county and pretty much throughout the state, which had in the past been funded by the Office of EMS, which initially was for years have been image trend. And they had recently changed within the past 2 years, I believe, to the ESO software, which has been completely funded, like I said, by the state. They announced recently, the Office of EMS announced recently that they would no longer fund it. They gave us 30 days to let us know that it was going to be done after that. And basically what we're looking at from the association is a recommendation from this body to the Board of Supervisors to have a resolution sent to the state reps to try to continue this funding from the state because of the cost of the software. The last time we looked at the software in itself, by itself, for 1 year was just around $3,200 for one agency. If you imagine the amount of agencies in the county that's got to shell out $3,200 within the next 30 days, it's a lot of funding.
Yeah, so I was at the association meeting last night that was talked about quite a bit. I think it's been about 15 years now the state's been covering the cost of this program. And basically, to just expand a little bit, the ESO system is the reporting software. It's how we do our patient care reports, and then they get sent over to the state. And also, you can build through it and do all kinds of stuff with the system, but it's very vital. It's a critical part of EMS now. Documentation is just as much as important as, obviously treating the patients first and foremost, but then you got to document it. And it's how we can track and trend and, get paid and be able to get statistics and all kinds of stuff. And then, of course, the state requires some sort of repository system, but you got to be sent over to them. So it's kind of, we had the drug box program get dumped on us, which that's kind of coming down from the federal level, but that got put back on the agencies, and between what the county's Board of Supervisors has allocated to us and paid for public safety and the volunteer stations, and then based off just my numbers that I've been able to pull from the volunteer stations, what they've had to shell out of pocket, we're probably around $250,000, $300,000 in this county so far in drug box program. That's what's been spent, because just on the complex boxes themselves was over $200,000. And then the stations it's probably right around $100,000, getting close to it, that everybody's spent to get their buildings and their security systems, and it's not done. People are still getting licenses, then they got to start buying drugs. So it's been a huge expense already, and we're in budget season. And I was actually going to bring this up under the budget communications tonight, but for the budget committee. But now that the chief's bringing it up now, it's a good opportunity for us to talk about it. I know at our last drug box meeting, it was kind of off topic, but Chris Christensen from WVMS, the EMS Council, he actually recommended that we ask our Board of Supervisors to send a resolution to the state legislators asking for this to be put back in the budget and to be reinstated. And he also recommended anybody, our public safety director, our county administrator, our county attorney, whoever could, our body here. So I know the association drafted a recommendation, and I think it would be something good for this body to support. I know there's only so many dollars out there, and we got radios still got to continue to replace, and we've got equipment that we got to replace, and everything's going up, and now we got to add drugs somewhere, how or another. We're going to have to budget in. You got to buy all the drugs now, and keep up with the drug box program, and now you got to buy your own software system to do your PPCRs. So, I don't know where the buck stops, but it's somewhere, I hope. So it's up to this body how y'all like to do it, but I definitely am in favor of sending a positive motion to the board. Floor's open for discussion.
So, actually, it can't hurt. All they're doing is asking.
Yeah.
Basically.
Sure.
All right. And this would include you all too, Director Key? Okay. I'll make a
I
motion.
don't think it goes into effect until June, I believe I'm right. June 30th of next year is when it goes into effect, that we'll have to start paying for our own.
I'll make a motion that we send a recommendation that the board draft a resolution to the Department of EMS to continue the funding of the ESO program as per the Fire Rescue Association.
Okay, got a motion on the floor. Do I hear a second?
I'll second.
All right, got a second by Tim Cassell. Is there any discussion on the motion?
Would it do any good also to, maybe I know Mr. Whittle has been talking with Danny Marshall's office, to maybe get him involved in it also?
Yeah, I think that would be great. Anybody that we can add to it to help. It's so I can tell y'all, and Casey knows this probably pretty well, and Chris I'm sure as well too. The Office of EMS is in a complete possible or makeover or change. So there's a lot of changes on the horizon possibly with the Office of EMS, but anything we can send up to our state legislators and the people we've elected to represent this county in those positions, they need to understand that we really would need this help if they can get this back in the budget. So, and that's here, it's the city of Danville, life-saving crew, they're gonna be in the same boat. Everybody's gonna have this issue, so. And you heard Damien, it's not cheap, so, yeah, I definitely would recommend Danny Marshall's office and anybody else they can call. All right, so I got a motion and a second. Any other discussion? All right, call a roll, please.
Jimmy Atkins,
Yes.
Ben Meeks,
Yes.
Alan Casper, Ward Rowland,
Yes.
Tim Cassell,
Yes.
Jason Lovelace,
Yes.
Kermit King,
Yes.
Coleman Mayhew.
Yes.
All right, that motion carries. Thank y'all. Chief Maracas, anything else?
I believe that's it.
Appreciate it, sir. All right, that brings us down to county staff reports. Director Key.
Yes, sir. We've got ATL funds, that's the aid to locality funding from the state, has been released. We now have it available. I've been starting to deliver the paperwork around to all the departments. If you don't use that this year, that does roll over, so you can carry it over if you need it for apparatus payments or something, down payment in the future on fire apparatus. It does have to be spent on fire equipment or apparatus. Today we had a hazmat drill at Ascent Chemicals. It was hosted by the Ringgold Fire Department. We had Ringgold and Blair's in attendance and the Danville Hazmat team. So it was mainly a drill for hazmat, but it worked out great for all involved. I left there a little bit after 1 and they was getting ready to do their second scenario. So they basically was there all day today doing a great hazmat drill. Don't forget the radio preventative maintenance work. It starts up next week. Please have your radios to the stations to get the preventative maintenance done. Also, we've got the CIP and talking with the budget that's coming up. We've got to do the planning for the CIP for the ambulance and fire apparatus funding for next year. I've already contacted the 2 departments that are in line to get the funding. One of them has declined the funding for next year, so I'm going to move right down the list. They'll fall right back in for the next year's replacement. An ambulance, that's each year funding. If anybody wants it, please let us know. Definitely by the next meeting, so that way we can get it put into the CIP funding. And last is the Skywarn class. It was scheduled for September, but got delayed due to a little natural weather incident that happened. So we've rescheduled it for December the 5th. It's a Thursday night at the Chatham Community Center at 6 p.m. And that's all I have, sir.
Thank you, sir. Any questions for the director?
Director Key,
Yes, sir.
the ATL money, is that is the max amount of years you can roll that over?
I haven't seen that. It doesn't say it in the rulings we get each year. I've got departments that rolled it over for 4 and 5 years. A couple of them have got about $50-some thousand in. This year's funding was a little bit more than it was last year. It's a little bit over $13,000 per agency.
Okay, so the state has no stipulation on,
And it's assumed that if you're rolling it over, you're going to use it for apparatus payment. You know, sometimes people will want to use it for the turnout gear or extrication, stuff of that nature. As long as it's fire related, you can turn it in this year, or if we just ask if you do roll it over, it used for apparatus payments.
I will make one comment. Don't forget your 4 for Life money.
Yeah, that's due in February, March, and that gives her enough time to get it turned in, but that's all medical expenses.
All right, thank you, Director Key. Any other questions? All right, sounds good. That brings us down to unfinished business. Any unfinished business? All right, here none. It brings us down to 13A. And I'll go ahead. Vic told me to apologize to y'all tonight. He was not able to be here. He called me. He didn't realize he had double booked another event. So he just sent me his, see if I can pull it up here. He said that as far as with the board communications, the only thing he had is active 911 has been reinstated to all of the first responders in the county. If you're a first responder, you'll have active 911 access for all the agencies. And he said, I'll go ahead and cover topic B, Fire and Rescue Memorial Update. He said we're waiting on the designs at this time to be completed, and then he'll update us hopefully in November. And that was it. He apologized for missing the meeting. So if you have any questions on those 2 topics, please forward them to him. All right, that brings us down to 13C, Drug Box Committee update. So I do apologize, I missed the meeting before last. My wife was having our second child, but Casey led the meeting and took care of the minutes and stuff for us. I appreciate her helping out with all this program so far. And then we had another meeting a couple nights ago. I can't remember what night it was. I think it was Monday or something like that. We had a meeting, but I think I've had so many meetings this week they've run together. But anyway, we met with Chris Christensen from WVMS, and we learned a little bit more information. We're not a whole lot new at this time, but basically the FDA approved a year extension for the drug box changeover. Now, what that really means is to be determined, because right now the state is still, in case you tell me if I'm wrong here or correct me if I'm wrong, they're still recommending to go ahead and push through. If you already started the process, which you should, and I'll happily say all 12 of our agency, which that includes public safety, has already applied for their Board of Pharmacy license. Several of them have already been inspected and passed. I know my agency, Blair's Fire and Rescue, we were inspected this past week. And then 2 agencies, Tunstall and Public Safety, already have their DEA license. So please make sure that you are following up on those licenses. I will tell you the DEA license, that's the step I'm at right now. It's about 6 to 8 weeks to get your license. The good thing is with the FDA coming out and saying they were going to push back the deadline a year, is now the state isn't so hard pushed on making us all switch November 12th. It was November 12th was the drop dead date that you'd no longer be able to use the drug box program in Virginia. We're now being told that's a good chance that's going to get pushed back. And Casey, correct me, they didn't say in the town hall meeting the other night if that's definitively been pushed back or not, did they?
They have not met with hospital officials, but they are pretty sure that an extension may be given for 3 to 6 months from hospital perspectives.
Okay.
But they are still in the meeting process.
So best case scenario is they give that 3 to 6 months, because then I will say that should put all of our agencies, because we've made sure we've stayed on at every meeting, drug box meeting, making sure our agencies are progressing. And some are a little bit slower than others, but we're all at least at we've sent in our licensing phase. We're in the licensing phase, so we can say that. All of them have their complex boxes. The director passed out the memorandum of understanding, or the agreement that we have to sign last night at the association meeting, how those boxes, we got them from the board paid for them, which we appreciate. So everybody's in a positive there, and the investigator, I call him investigator, inspector, I should say, that came to our building this week, he was very pleased, and he said so far everywhere he'd been in Pittsylvania County had done a great job. He made that comment that we were much more prepared than some places. So I'm at least happy about that. We'll have another drug box meeting in a month, and we'll update you guys then. But we got to really be thinking about the future of, as far as these drug prices and stuff that's going to feed into our budget. Casey, anything I missed? Do you think that'd be important? Sounds good? All right, any questions? All right, thank y'all. All right, and then brings us down to budget. So I was going to mainly touch on what Chief Maracas had brought up about the ESO, because that's going to play big into whether we need to include that in the budget or not. But we've already covered that, so hopefully that'll at least help a little bit. The only other thing I can say is the association last night discussed the budget, and they have planned to put together some individuals that's going to start meeting with our 2 representatives, which is myself and Vice Chair Kermit King. We're going to meet with Scott Hutcherson and Director Key, and start crunching some numbers so we can present to the association and present to this body. So hopefully we can get the finance director some hard numbers, because we're getting ready to gear up for budget season. So any recommendations or concerns or thoughts, please let Chris or Casey or Scott know, or myself, and or Kermit King here, or Chief Fowler, Chief Maracas, and we'll try to make sure they get to the committee. So hopefully we'll have our first meeting this upcoming month. All right, and then, and one thing I was going to bring up, did you look at that paper to see who was on the, I'm drawing a blank, the Recruitment and Retention Committee?
No, I sure didn't.
Okay, because they did bring, the association asked last night where we was at on that, and they want to include that into the budget so that if there's anything, initiatives we need to try to, so if you get with Chief Fowler, he can fill you in.
Casper, King, Neil, and myself are the four that's on the recruitment committee.
Okay, all right.
I know I was on it, but I couldn't remember who else.
Okay. You have to call old Mike, tell him you got to come on back.
There you go.
All right, that brings us down to item E, response coverage, stats. This will be Director Key.
Basically, I wanted just to bring up the past 2 weeks, just to make sure everybody's aware of the call stats for everybody's responses. They are included. I will be doing this each month, just to add it in, just so people can see how the agencies are doing for this year. So that was the 2 weeks prior to me getting this up and printed. I didn't include today's. Because we've got a couple agencies that are struggling, and they're below the 70% mark. So I wanted everybody to be able to ask the questions.
So correct me if I'm wrong, so with our matrix in place, if they're below the 75% mark, they don't get their full funding, is that correct?
70%.
70%,
Yes.
okay.
The
70%.
According to the service agreement,
Yes,
right?
that's right.
Okay. So, Director Key, on the agencies that are below the 70% mark, have you reached out to them to, I guess, just kind of see where they're at in the process? Or, is that something that collectively we can do, or just to, not as a fussing, but hey, where can we help out at? What's going on? Is it anything that needs to be done on our end?
I think it needs to come from multiple directions to ask the questions of why, why are you struggling? Is it, membership? Do you need, what do you need to keep going?
So I think it's going to play heavy. It was discussed highly last night at the association meeting. Good input by everybody that was there. The association's working on some planning, some strategic planning. But I think it's going to play heavy into this discussion as well going forward. But we definitely need to help each other out. And whether it's the volunteers or public safety, we need to make sure we're working together. So I just encourage any of these agencies, if you're listening or anybody up here and you need something, my phone's always on. And if I don't call you back immediately, I promise I'll get back to you within a couple of days. But yeah, we can take a look at this and maybe get together a game plan to approach who's struggling. I think if we had an unlimited amount of money and unlimited amount of trained people, we wouldn't have nothing to worry about, but we don't have that, unfortunately. So, but any questions for the director on the statistics? Okay. Anything else, Director?
No, sir.
All right, thank y'all. All right, that moves us down to other matters from the commission members. And we're going to start over here with Chief Maracas.
I have none.
Good, okay. We'll go down here to Mr. Atkins, Jimmy Atkins.
I don't have nothing.
Okay, thank you, sir. We'll come back to you, Vice Chair. Director Key.
I just want to thank everybody that showed up today for the hazmat drill. This is something that's required from a lot of the chemical companies in the county. It was sort of a short notice, but Ringgold and Blair showed up, did a great job assisting the Danville hazmat team and everything, and it was a success today. So I think a lot of learning took place. So my hat's off to them. Thank them.
Thank you, sir. Ms. KCC.
I just want to thank the agencies for participating in the drug box, everybody working with one another, bouncing ideas, and I think it's been successful so far.
Yeah. I'll add, Casey's been a huge asset, and she's exactly right. If we could get everybody to buy in like they bought into the drug box thing, I believe we might be all right. At least it'll be a start. So thank you for saying that. All right, Mr. Rowland.
No matters.
Okay, thank you, sir. And welcome tonight, our new member here, Mr. Jason Lovelace. You got anything you'd like to say?
No, sir, I don't have anything.
All right, thank you, sir. Mr. Cassell.
I'd like to thank everybody from this whole region that has gone above and beyond to help out in the western part of Virginia and North Carolina with all of the manpower, equipment, supplies. I know a lot of people personally that have been out there, and I just want to thank all of them.
Absolutely. Thank you, sir. Mr. Coleman Mayhew. Thank you, sir. Vice Chair.
Yes. Like I said, right, I always thank your volunteers because they do a super job. I know we look at these numbers and, we kind of, our system is driven on numbers. That's what it is. But sometimes they don't tell the whole story. But if you ever, like your tornado disaster, from the dispatchers all the way to public safety to the volunteers, you didn't have any problems that I knew of, or that Chris called me about, or I heard about. So, but they did a good job. They're missing person. I get a text one day, we got a missing boy, look out. So, hey, but it's in my neighborhood.
Yeah. Yep.
But they did a good job. Thank y'all for the job you did. But like I said, sometimes we do leave the dispatchers out, but we're still thinking about them. And like I said, police officers, they were here a while ago, but I think they left. But, it's a collective effort. But like I said, sometimes, we get hung up on numbers, and we do. We all could do a little bit better in answering calls or pulling together sometimes. But we get there. But thank y'all for what you do.
Thank you, sir. And that brings it down to me. I promise I'll make it short. We're making good time tonight. So again, kind of to just state this again, like Vice Chair just said, I can't thank you volunteers enough. I got up and spoke Tuesday night at our Board of Supervisors meeting, and I made sure to mention our dispatchers. We can't forget about them. They have a hard job, and they do a good job. Our Public Safety Department, I think we're working really well together, and places we're improving on, and I appreciate that. And our Board of Supervisors, I got up there and said for the second time this year, and I mean it, I really feel like we've got a good Board of Supervisors that's helping us out, that's really trying to put our needs and not our wants maybe, but our needs first. And hopefully coming up budget time here, we'll be going to them again. So, hopefully we can continue on that right track. But I appreciate their time. As far as commissioners, thank y'all for being here. Good meeting tonight. Thank the Life-Saving Crew for being here. It was a great presentation. Appreciate that program. I think it's truly making a difference. My wife just had the second child, and she's had high blood pressure, and it was really unique because when we left the hospital, we actually had a community paramedicine from Central come to our house to just do a follow-up and check on her and check her blood pressure and all. And I just thought it was so cool. I sat and talked to the paramedic for a long time. And so it's kind of expanding all over the place, and it's good. As far as the tornado response, I want to thank everybody that had a hand in helping out there. Public Safety Department, Chris, they did a great job. Chief Fowler, he was command of that scene. For the operations, he did a great job, amazing job. Good responses by the volunteers. We were lucky to only have one injury. We were lucky. Now, I know some people lost their belongings in their homes, and we pray for those individuals, but nobody lost a life, so that's what really matters. We keep the people in prayers down in Asheville and western part of the state and Tennessee. We talked about it Thursday night. Chief Neal, if y'all didn't hear it, go back and watch it. He gave a good speech during the hearing of the citizens to the board. That is one of the main reasons we need a push to put our SOT team back in place. Have funding for them, support, have a true system where they train and they're good to go. We got some good people in this county that have a lot of training, and we got some equipment. We need some more, but we'll get there. But the folks in Asheville never thought they would have a 1,000-year flood happen the other week, but it did, and it can happen here. And it proved why we need those operations. We rely on the city of Danville a lot, but I can tell you right now, if it's pouring down rain in Blair's, it's probably raining in Danville. And the Life-Saving Crew and the Danville City Fire Department's got to take care of their citizens first. So we got to get prepared, and that's something I think last night we started at the association level, and hopefully this body will be able to help along with public safety getting that going. And we're going to need our board support on that. As far as back to the tornado, great response. Communication was good. I just think it showed that we can come together for the right reasons, and our system works well when we need it to. So appreciate everybody coming out tonight. We got Mary Widow out in the audience. I'm glad he comes out and supports all of our meetings, and the chiefs that came from the agencies, and appreciate y'all being here. Y'all have a good night. Meeting adjourned.